This is a time without pity. This time the enemy is silent, invisible, deadlier. This time there can be no truce, no treaties. It is a zero-sum situation. This time the enemy is not a child soldier. This time the enemy is a virus, a killer virus. This is a time of constant wailing. Ambulances shrieking under the hot tropical sun, striking macabre fear into the heart. This time, the enemy is called Ebola. I am standing right outside one of the major Australian hospitals in Melbourne. It's just an example of what Australia has produced in the medical profession. The Australian medical system is world class. If you are sick or hurt, there are all kinds of systems to assist you, to bring you by helicopter. And of course, there are very strict hygienic procedures in the wards. Doctors, nurses, specialists, the anesthetists, they're all very well paid. If you are poor, you still get excellent medical treatment. Doctors have state-of-the-art equipment, which means that diagnostic testing is done quickly and accurately. There is an abundant supply of doctors, nurses, specialists. But these are not necessarily the conditions that we would find in West Africa. Hospitals and clinics are usually overcrowded, and hygienic conditions vary greatly from hospital to hospital. The poor do not necessarily get the same treatment as the rich. There is also a limited supply of specialists. Medical equipment and machinery is quite often outdated. Diagnostic testing and therefore therapy in some cases is simply not available. By and large, doctors, nurses, specialists are not well paid. And the scourge of malaria, typhoid, TB, polio, which are endemic to that region, simply overwhelm the medical system. And recently, we were struck suddenly with the deadly epidemic of Ebola.
Outbreak does not stop now. We could be looking at hundreds of thousands of people infected.
There is a window of opportunity to tamp this down, but that window is closing.
Ambulance team. The job is very, very hard.
They say that the body had been there for a long time, so that's why they got angry. The entire city is covered with bodies. There is nothing we can do. There are patients all over. The first thing I do, I give them courage. I tell them, don't be afraid. They feel fear. I see it in their eyes. I don't rest, even when I go to bed. brings his final patient of the day to a treatment center. All the beds are full. There is no space. The doctor said he can't take people because he's supposed to admit 50 patients, but now he has 85 in there. He is overcrowded. She's very critical. She's vomiting. She's weak. If she doesn't go in, she will not live. Ebola will last for long. In the next 3 or 4 months, the Ebola will be worse.
I wish I could do more, but it's not easy. We try our best, but we cannot do more than what we can do.
The 17-year-old girl died at home the next day. The Ebola outbreak first hit Sierra Leone around April of 2014, which was nearly the beginning of the rainy season, and this complicated the situation. In the beginning, people were actually in denial about the existence of Ebola. We didn't know much about it.
They are reports. Some of them are they don't even believe that the Ebola virus is real.
By not being aware, many doctors and nurses were infected by the virus. Many died. Up to now, some 500 medical people have been infected by Ebola in West Africa. In the early phase, the medical profession was in total disarray.
In Sierra Leone, Ebola treatment centers are reduced to places where people go to die alone. It is impossible to keep up with the sheer number of infected people pouring in our facility.
And unfortunately, the international community, including the World Health Organization, was not taking it too seriously.
Thursday's announcement marks a major raising of the response by the WHO. It had come under criticism by some agencies for reacting too slowly to the Ebola outbreak.
I've been calling, attending meetings of WFP and WHO, and I haven't got any help yet. Nothing at all.
It was only Doctors Without Borders who understood at that time the severity of the problem. In those early days of the outbreak, people were dying by the hundreds, if not thousands, in West Africa. Bodies were left in the streets. Bodies were left to rot in the houses without official pickups. This only angered the people and exacerbated the problem. Of course, some of the doctors and nurses acted very heroically in the face of this threat. Others, however, did abandon their post, and we were left with a skeleton medical service and some pharmacies. By September, October of 2014, the local governments began to apply serious emergency measures to stop this terrible outbreak. These measures included roadblocks, random temperature checkings, chlorine hand washing, and national lockdowns.
Officials planned the national lockdown so health workers could go door to door to find Ebola patients and to educate residents about the disease.
Only church services were permitted for a few hours during the day. Furthermore, there were no public gatherings, no cinemas, no sporting events, no discos, no restaurants. Things were shut down. Trading was restricted for a few hours during the week.
The legacy of Ebola quarantines is being felt even after the quarantine's been lifted. This is Lago in eastern Sierra Leone. It was one of the areas first hit by Ebola. The government restricted movements and trade across the whole district. Falls in supply of local and imported goods pushed food prices up 25%, and they remain high. Mums are struggling to put food on the table.
And the international community began to take this seriously and began to send help.
Personnel are deploying today. They'll join the 40 people that I've already got out there running conventional hospital facilities and providing primary health care. These personnel will all be working in the Ebola virus treatment unit, which is a 12-bedded facility for international and national healthcare workers. We've conducted a 9-day bespoke training package up at the Army Medical Services Training Centre in Strensel. We'll be introducing the personal protective equipment that we'll wear in Sierra Leone, and we were able to...
Since the beginning of the Ebola outbreak last April-May, our Orthodox mission has launched several anti-Ebola projects. These include education, medical assistance, hygiene consciousness, food distribution, and constant church services.
This is not the time to relax right now. In fact, this is a very dangerous time now to relax. So, remember, wash your hands in chlorine. Remember, don't touch anybody. Don't touch anybody.
Through our sponsors in Australia, in America, in Greece, we received many containers of food supplies, which we then distributed to the people.
I'm so glad today to receive these items in this Ebola crisis. I'm so thankful to the donors, especially the Paradise Kids for Australia, who remember us in this crucial time. I'm so thankful also to the Orthodox Mission in Sierra Leone for helping us so that at the end of the day, we can stay indoors and be not contaminated in this Ebola crisis.
For 3 days, we don't have enough to eat. So the father sees the situation that everybody should come here to eat. So they are going to give us food now so that we will not suffer for the 3 days. We thank all of you that are helping us in this country. Continue to do this, that may God may bless you, all of you. Thank you, we give you praise for all that you are doing. Help us day and night so that we may not suffer.
Through Paradise for Kids Australia and USA, we received constant supplies of anti-Ebola protective items. These included gloves, masks, antiseptic, and medical scrubs. These items were distributed to our mission members as well as to the general public through the government. One of our current projects during this Ebola period is to feed some 400 children of our school, many of which are Ebola orphans. One of our major targets now is to take care of children whose parents have died of Ebola.
Thank all the people for vaccine for helping us, the Orthodox.
We are right now in the process of establishing 2 large modern orphanages. During the recent visit of His Eminence Metropolitan George in June of 2015, we celebrated the groundbreaking ceremony of one of our 2 Ebola orphanages. These 2 orphanages will cater, house, educate, feed children between the ages of 3 to 1617. By August of 2015, none of our Orthodox members experienced death through Ebola. Thank you, Paradise for Kids, Australia and USA, for your help. Thank you, all our sponsors in Greece. You helped us to fight Ebola, and we won.